welcome you to In Focus. Hey there, I'm Allison Walker. Now, one of the biggest focuses of this year's legislative session, healthcare, of course. And the industry is growing as the state's population swells, but there may not be enough doctors, nurses, and caregivers to go around. And the Florida Hospital Association estimates that by the year 2035, Florida will have a shortage of 59,000 nurses and 36,000 physicians. That sounds whopping there. So it's why the governor recently signed into law a package of bills known as Live Healthy. And this package focuses on growing the medical workforce, increasing healthcare access, and promoting technological innovation. So that's kind of the 50,000 foot view, if you will. But what benefits can Floridians expect to see? We're talking both short term and long term. So I'd love to bring in our panel today to talk about this. We have State Senator Colleen Burton, of course, one of the architects of the Live Healthy legislation. Senator, welcome back to our show. And we have David Micah Jr. You got it. And David is the Executive Vice President of Public Affairs for the Florida Hospital Association. And also back, Pam Nabors, President and CEO of CareerSource Central Florida. Wow. So honored to have the three of you here today. Such an important conversation. And Senator, if I may, just kick this off with you. You know, you were part of the big push to address the healthcare worker shortage issue, you know, in the state legislature this whole year. And this all comes back to how rapidly Florida is growing, right?
Absolutely. We know that Florida is seeing exponential growth. Every year we're growing by an average of at least 300,000 people, which is, that's a mid-sized city here in Florida. And what we also know, unfortunately, is that when those new Floridians join us, they are not bringing a proportionate number of healthcare providers with them. So of those 300,000, how many of them, not nearly enough, are healthcare providers? And while it's been, you saw the numbers already from the Florida Hospital Association, the numbers are bad. Looking forward, the numbers are bad today. You know, where we are as a state today means that individuals who are seeking medical care are having a difficult time finding it. And we are finding more and more that Floridians, regardless of their insurance status, are having great difficulty, particularly in finding family practice and also specialty physicians as well. We have lack of access to mental health care providers just because we don't have enough people in the system right now. So what we did with Live Healthy is take some big steps towards moving us in the right direction so that Florida can be a place where people can move to, they can live, they can grow up here, become a senior citizen, and have great access to healthcare.
So a lot of this then comes down to dollars and cents, right? And so David, we're not just talking about the workforce, providing services, that can be expensive too. So David, how much of a difference do you feel will the Live Healthy initiative make with what you do every single day?
Well, Allison, first of all, great to be with you today. Great to be back in Lakeland. I was born in Lakeland, actually, at one of our member hospitals, Lakeland Regional, before I moved back to Tallahassee with my parents. So great to be here today. Look, the reason that hospitals care about this and want to care about what resources are available is that we want to be there and have been there in the past and in the future, and making sure that we can rely on a sound business practices that exist and adequate and fair reimbursement for those practices so that we can maintain those businesses and operations across the state. Live Healthy was monumental. I cannot say enough about the work that Senate President Kathleen Passidomo did and Chair Colleen Burton on these major pieces of legislation. We have not seen work like this across the finish line in probably decades. One I want to highlight, first of all, in the reimbursement and the Medicaid program for labor and delivery rates for children. Nearly 46% of kids in Florida are born on Medicaid, and the state took a very strong stance of saying that we're going to reimburse these services. We understand, as Senator Burton said, we need to get the workforce, and the bulk of those resources, those reimbursement methodologies, go to that workforce for doctors, for nurses, for allied health professionals. And so the commitments that were made in Live Healthy that will move on in the future cannot be understated, and the significant impact they'll have now and in the future on our healthcare delivery system.
Yeah, it cannot be understated indeed. And then going back then to the workforce issue. Pam, what have been some of the challenges with building up the state's healthcare staffing? And does the future look now a little bit brighter? Is there some glow here or what?
Yes, absolutely. And thank you also for including me on the panel today. So healthcare, obviously, here in the Central Florida region and really across the state is the #1 sector for growth and hiring. Just here in Orlando right now, in the Orlando region, which is 5 counties surrounding the city, we have almost 20,000 openings for both registered nurses and LPN, licensed practical nurses. And so in bolstering the workforce efforts for both the healthcare providers and individuals to look at these careers as opportunities, it really is the beginning of a silver lining to get more individuals into the healthcare space. And I think what often is not apparent is that individuals can start in great jobs with medical, say in a medical clinical assistant, where they can start a wage at around $40,000 a year here in the Central Florida region, but really progress through a career path for a licensed practical nurse, a registered nurse, or even a nurse practitioner, where now they're making a very substantial wage of over $100,000 over that period of career progression. So these resources in the legislation will really bolster the effort to get more individuals into healthcare careers.
So as we're getting these folks into these careers, we also need to make sure that we have the access to their services, right, to their specialties. So Senator Burton, the question of access here, what's the state doing to ensure that Floridians can get care no matter what corner of the state they live in?
That's a great question, and the bill speaks to that in a couple of ways. The first one is a big investment in tuition reimbursement in medical practitioners, not just physicians, but dentists, nurses, dental hygienists, and behavioral health care providers all across our state to be eligible for the tuition reimbursement, which, let me back up a minute and tell you, we've done before, but at a much smaller dollar amount. Fewer practitioners were eligible. We expanded the base of practitioners and put a lot more money into the program, because what it will do is it will place healthcare providers all across the state in communities from one end of our state to the other, with just a few qualifiers. One of them having to be, it needs to be a medically underserved area, which if you look at a map of Florida, outside of the major metropolitan areas of Florida, for example, the greater Orlando area, the greater Tampa area, I am in between Orlando and Tampa, and my community, my county is medically underserved. So it's up and down the state, from the tip of Florida, especially the center, all the way up across the Panhandle. So if they practice in a medically underserved area, that's an eligibility point for them. Additionally, something that's huge in this bill is volunteerism. One of the qualifications to participate in the tuition reimbursement program is going to be volunteerism. We want these practitioners across the state to volunteers in the communities. And what we've done also, in order to increase access at free and charitable clinics, where we think a lot of them will be volunteering, is we have raised the eligibility criteria for patients to go to those clinics. It was at 200% of the poverty rate. Now it's up to 300%. So that's a pretty dramatic increase on those individuals who will be eligible to receive care at those clinics. We've also provided some funding for clinicals. We can have the greatest medical schools, the greatest training facilities for nurses and other healthcare practitioners, but a big part of the component of that training is clinical training. And a lot of our federally qualified healthcare centers across the state are eligible to do that. They want to do that, but it's expensive, right? You have to have somebody, a preceptor, somebody working with them in their clinical time. So now they will be able to do that and get reimbursed for those expenses, which makes it easier for them to take in those practitioners to expand their practice areas. And these healthcare centers are all across the state, from the Panhandle down to the tip of Florida. That will help increase access significantly.
So then with these healthcare centers, David, what are you hearing from the hospitals and providers that you represent? What do they need the most? And is the Live Healthy initiative going to give it to them?
systemic problem healthcare is across a long continuum. You can't look at it just as one piece, right? Acute healthcare in the hospital. Hospitals in Florida are committed to serving the entire continuum there, from primary care that they're invested in to behavioral health and long-term care in some cases. And so we have to look at this holistically. And so we've talked about workforce and that importance, but we've also talked, and this bill really focused on increasing the levels of primary care available through those federally qualified health centers and increasing our workforce so we can meet those demands, because we want to make sure people get the right care at the right time in the right location, because that makes the system work better. And so as this bill does, it focused on doing that. Our legislature came together. We really saw Tallahassee working incredibly effectively to move this legislation through. So this will start to answer those long-term issues that we're ready to focus on as a state.
And Pam, then, to wrap up this block, how do you encourage the next generation to choose the profession?
Well, actually, you start early and young, even in middle school. And in fact, CareerSource Central Florida, as well as some of my colleagues around the state, are actually working with young adults in high school to expose them to careers. Just recently, in our program we call High School Career Express, we took 55 young adults. They were seniors in high school here in the Orlando region to one of our hospitals, and they actually got to tour a hospital. They got their own scrubs. They got to go into, obviously, an unused surgical room. They were so excited. The young people didn't want to take off these scrubs. They were given to them, and they got to wear them at home to their home base. And it was so thrilling and inspiring to see how these young people, when they look at what kinds of jobs exist inside of a hospital or a clinical setting, it really opens their eyes to the opportunities that might be in that career pathway.
That's so empowering, right? Their superhero, outfit that they've been able to don. Awesome. So, panel, we're going to pause real quick for our first break. We have so much more to get to on this topic. Stick around, folks, and Focus will be right back after this very short break. Stay tuned. And back on In Focus, we are talking about Florida's new Live Healthy package of laws that aim to prepare the Sunshine State for the years to come. So, David, one of the focuses of Live Healthy is on healthcare innovation. So what role do Florida's hospitals play right now in pushing the industry to new heights?
This is, Allison, thanks for the question. This is an incredibly competitive and innovative industry in general. And right now you see Florida's hospitals really pushing the envelope as far as we can to do care in new settings, to use technology, including AI and lots of different things to make sure that we're meeting the demands of healthcare in this state. And Live Healthy really, again, dove in on this issue and looked forward. It didn't look for the solutions of today, it looked for the solutions of tomorrow. And one of the ways that they did that was the legislature took the initiative to invest almost $500 million over 10 years in a revolving loan program that will allow hospitals and other providers to submit grants that will be matched by the state to do that innovation, to take those risks and invest in new technologies that will continue to bring health care in Florida. People shouldn't have to travel to Boston, to New York, to LA to receive the kind of care that they need. We can have that in Florida. Our hospitals are committed to investing that and are ready to keep pushing that envelope to provide that care to our citizens.
Yeah, so then, looking ahead, Senator Burton, is Live Healthy a solution for the years to come, or do you feel like it's just the start of something that will have to be built upon?
We built a lot. This past session already. I think it's, we could do a 2-hour broadcast on Live Healthy and dive deep into every issue that's included in it. What it does is it sets the stage, though. It sets the stage for a robust healthcare community here in Florida, a growing healthcare community. We have a robust community. We have great care today, but we need more of it is what we need. It sets the stage for access, greater access across across our communities, especially that are currently medically underserved. It sets the stage for us to be a less cumbersome state regulatory-wise for physicians who want to come move here from other states or, quite frankly, from other countries as well, who are highly qualified and who want Florida to be their home, along with those hundreds of thousands of other Floridians who come here every year. But it's phased in. There are parts of it that will have more immediate impact. For example, the tuition reimbursement program that we talked about already, but also we are expanding graduate medical education. What we know in medical education is that if we grow our own, if physicians particularly and others, nurses as well, if they are trained in Florida, the likelihood of them staying in Florida is great, is that much better. So we have invested money in that, in advanced training, in more training, more money for nursing, as well as for physicians, as well as for behavioral health care providers, by putting them in places where they can get their clinical work done. So there's a short-term part of it and there's a long-term. And I have to tell you, the partnership between every element, if you will, of healthcare in this state, along with the legislature to build Live Healthy, was monumental. It was practitioners. It was healthcare organizations like the hospitals. It was our federally qualified health centers. It was behavioral health care centers. Across the healthcare spectrum, people got on board, and by getting on board, I mean they gave us input. They talked to us about the needs that they're seeing out there in their communities. We, of course, have every senator and every state representative representing Floridians all across the state who all had anecdotes. Everybody has stories about back home and how people can't get the care that they're trying to get. And we just see it getting worse every year. This takes us in a big step in the right direction to build a better future, a better healthcare future for every Floridian in the state. I'm really excited about it. For somebody who's worked in healthcare policy for as long as I have, to be able to work on this with the Senate President Pasadomo was just a gift for me. Sometimes legislation feels like a gift because I'm working on something that I'm passionate about. And as David Micah knows me well and has worked with me on lots of things, this was for me. This was a big gift, and I was really excited to get to work with it.
You know, and you mentioned that everyone has their stories, and I know we did set the table on the fact that Florida faces a shortage of healthcare workers, even with my baby girl in NICU and PICU. She's 15 months now, and when they say there's not a room available, we see all the rooms available. They say that because there aren't enough healthcare workers there to tend to her. So, Pam, for you, how does this shortage, how does it compare to other industries? I mean, unemployment is low across the board right now. So is it not having enough bodies a universal issue, or is it this industry that's hit particularly hard?
So it's every industry has shortages. Part of that is demographics. People like me and the baby boomer set of generations are leaving the workforce and also wanting more healthcare. And so healthcare kind of gets doubly impacted by both the changing demographics, the fewer workers, and the multitude of opportunities that are available across the state. What I think is exciting about this legislation, as Senator and David have said, is that it really looks at the spectrum of healthcare needs, not just in hospitals or clinical settings, but even in dental offices and all of the different, and mental health, all of the different aspects of what is needed. And I think it's the beginning of the solution. We, as the Senator said, as an ecosystem in the state of public and private providers, we need to work together to continue to build the solutions. But it's definitely also an incredible career path and opportunity for individuals to earn a really great wage and progress in their wages and their lifestyle over time. So we're really thankful that this is happening.
Boy, so much more to get into. I know we're approaching the top of the hour now, but I'm looking forward to your final focus as we take our last break here on In Focus U3. Stay close. We're back in just about 2 minutes. All right, Live Healthy. Here we are back for our final focus here on this show today. So, Senator Burton, final thoughts. When will Floridians see a difference in healthcare staffing and/or services?
Floridians should see a difference as soon as the fiscal year begins on July 1 and the funding that's in this bill is available. They will see a difference immediately. And I would suggest that across communities in our great state, communities need to come together and make sure, do what we can do as community members to make sure that our friends and neighbors know where to access this great health care that's going to be available. They'll see it very soon, though.
Because when stuff becomes law, we love to see the tangible results. So Pam, training the next generation of healthcare workers, then, we can say it's already in progress, right?
Yes, absolutely. And we at CareerSource Central Florida are already working with our education, our university and college partners to look at what opportunities can we reach out to our healthcare providers, our hospitals, to actually bolster the training opportunities that are here in this region and all of the regions across the state to really take advantage of these resources coming into our communities.
And David, then, of course, we know, we've been talking about the whole show, Live Healthy. It's a huge initiative. So tell me what you're most excited about with this.
Well, Florida's Hospital Association and our hospitals we represent are committed to bringing a modern, sophisticated healthcare delivery system to Florida. This bill does that. The commitment of the Florida legislature to focus on this does that, and we look forward to being the rock in those communities to provide that health care and part of them for a very long time to come, and look forward to working with all of you as well.
Well, I've learned so much from the three of you. Thank you for your time here on the show. Come back anytime. Senator Burton, David, and Pam, thank you for your thoughts. And folks, we appreciate your company. As always, thanks for watching In Focus. I'm Allison Walker. Cannot wait to see you right here next week. Take care.